Parents know that having a child isn't cheap. In the United States, on average, it costs nearly $19,000.
And health insurance can help lower that price tag, but not everyone has it.
In tonight's Eye on KELOLAND, we show you a local clinic that's working to help expecting moms afford pregnancy care. Inside the Sanford Women's Hospital, just down the hall from the birthplace wing, you'll find this OB clinic. Marissa Blum has had all 5, soon to be 6, of her kids with the team in this clinic.
Honestly, financially, it's been very helpful. And I guess in a way, maybe I'm a little bit drawn to it simply for the fact that I'm helping out. In a sense, this practice is helping out new doctors starting out.
This clinic has a twofold mission. First, it helps relieve some of the financial burdens on expecting families.
This clinic started back in the early 1960s, actually, and it was a partnership between Sioux Valley then and Lutheran Social Services. And what they found is that we had women that didn't have other resources to help them pay for their prenatal care and their delivery expenses, so they therefore would not get any care, which left them with sick moms, sick babies, all kinds of tragedies, if you will.
That doesn't mean the care is completely free, though.
We provide prenatal care, we provide delivery expenses at the hospital, any medications they need through their pregnancy, it's all under this package. So it's really a fee-for-service program that they pay for, a set amount. Whereas if you went to the doctor and you had labs drawn and a doctor's visit and an x-ray or something, you'd get individual charges for all that. They get charges for that, but they pay this flat fee.
The second part of the clinic's mission is training new doctors.
We want experienced clinicians out in our rural settings or in Sioux Falls. We want them experienced. So every year in July, we get a fresh batch of brand new residents fresh out of medical school.
And sometimes those residents stick around and assume much larger roles in the clinic.
I was actually a resident in this program in OB Clinic. I've been here as a medical director for, this is my 3rd year, starting my 3rd year.
It's a unique program that impacts people far beyond Sioux Falls.
We are the only program of this sort in the region, so it's really good. We've had patients come as far as out West River, like by Rapid City, to get care here.
Care that's needed and important.
I worry about what would happen to these women and these babies if we weren't here. The burden of the cost of medical care can be substantial, and so we worry that people would ration their care or not seek care at all. And so we're here really to provide that safety net.
While the clinic is only open on Thursday mornings, there are still great bonds nurses and doctors are able to make with their patients.
There's several families that have had all of their babies with us, and I think that speaks volumes to the care that we provide and the program that we have, that I think somebody that comes back for their care 7 or 8 times just really talks volumes.
A sentiment Blum can attest to.
You get to know all the nurses, and you also see them again when you deliver your child often times, and it just kind of turns into a family in a sense.
The clinic is small and only able to help around 70 patients a year. Expecting parents can learn more about it from sources like the Helpline Center or get referred by Sanford Family Doctor.